Bismillahirrahmanirrahim. The topic of this presentation is red blood cells in human body and their interaction with surgeon. The human body makes 2 million red blood cells every second, and at the same time 2 million RBCs are destroyed every second. This is a very important topic for surgical residents or surgical trainees, that they should know how to deal with anemia, specifically preoperative anemia. Peroperative anemia means peroperative blood loss, and postoperative anemia. So the objective of this presentation is we will discuss some very special features of red blood cells, how to deal with pre-operative anemic patient in surgical outpatient, how to deal with the peroperative blood loss, post-operative blood loss and post-operative anemia. Is it anything like normal hemoglobin of Pakistani male and female? What is a unit of blood? We talk about a lot about pint of blood or unit of blood. So what exactly is the correct name? We will discuss that. Is it possible that the blood can be red or blood can be green? Yes, it is possible. I will let you know how. What is massive blood transfusion? What is definition of massive blood transfusion, and what is the utility of massive blood transfusion and complication expected by massive blood transfusion? What is autologous blood transfusion? This is very important topic, specifically in a country which has got not many resources to spend on health of the people. So you have to listen very carefully. Is there anything like synthetic red blood cells, or what is the future of blood transfusion? We will discuss that at the end of the presentation. Briefly repeating the functions of blood. Number one is maintenance of intravascular volume. So if you do not have blood, there will be no volume inside the blood vessels. Oxygen carrying capacity is a primary function of the blood, so it carries oxygen from one part of the body to the other part of the body, and at the same time carries carbon dioxide back to the lungs. Hemostasis is very important part of the blood, and maintenance of oncotic pressure, which is mainly by the proteins. Why RBC is disc shape? Because it provides large surface area to carry more amount of hemoglobin. It can swell easily and also squeeze easily through small capillaries without rupture. So if the surface of the RBC is just flat, it will not carry as much as amount of oxygen when its surface is concave, because it increases the surface area of red blood cell. Had it been spherical in shape, it would have been subjected to stress and lysed very easily, as we can see in some diseases of the red blood cells. There is no nucleus in red blood cells, but why there is no nucleus in red blood cells? Losing the nucleus enables the RBCs to contain more oxygen carrying hemoglobin. So because the nucleus has got a volume, and when that volume is gone from RBC, and that volume is replaced by more oxygen and more hemoglobin. So that is why the nature took the nucleus out of the red blood cells. So it can transport more oxygen and at the same time more carbon dioxide from one part of the body to other part. Why is RBC red? It is not only hemoglobin which makes the red color of the RBC. It has got iron, and when iron is combined with oxygen, remember this, iron and oxygen, when they are combined with each other, then they can give rise to the red color of the RBC. Is there anything called a blue blood? Yes, the nature has produced so many miracles in the world. Octopus have got blue blood. They have got copper rather than iron based blood called hemocyanin, which turns its blood blue. So blood is not always red. It can be blue, but it happens in octopus. Is there anything called a green blood? Yes. Leeches have got blood containing the protein called chlorocrurorin. Chlorocrurorin. This causes the blood to turn green. It is another oxygen binding protein. So these are two oxygen binding proteins, but they can give rise to the color of the blood blue or green. But humans have got red colored blood. It cannot happen, or it cannot be converted to blue or green until the patient is extremely cyanotic. The blood appears to be bluish red. Otherwise, it is never blue or green. This is very important to discuss that a unit or a pint which should be used. We normally write on a prescription sheet that transfuse 1 unit of blood to this patient, or we write transfuse 1 pint of blood to this patient. Which is correct and which is incorrect? Fortunately, they both are correct, but currently the situation is that in most part of the word pint is obsolete. Most of the places in the world, they use a unit of blood. So a unit of blood or a unit of plasma or a unit of platelet, rather than writing a pint of blood. So I strongly suggest that you should stop writing pint of blood and start writing a unit of blood rather than writing a pint of blood. One blood bag is 1 unit of blood. So what is in the bag? There are different kinds of blood bags for collection. The common type is a single bag containing 63 ml of anticoagulants. These are the anticoagulants to collect total volume of approximately 450 ml of blood. This volume can be 10 milliliter plus or can be 10 milliliter minus. So what exactly a bag of the blood contains? This is not a pint, this is a unit of blood. Just to remind you of good old days, this is a Pakistani note which was used before 1971, because you can see here, you see there's a very strange language written on the note. I have actually used this note when I was very young in class 4 or class 5, because I still remember the 1971 war and the unfortunate incident of separation of Pakistan. So what happens? This note is not gone anywhere, but this has become obsolete. So the same thing happened to the pint. The pint is a unit of liquid 1/8 of a gallon. So you can't see any gallon written on the pack of milk or on the petrol station. So 2 pints were equal to 1 quart and 4 quart were equal to 1 gallon of a liquid. So just to give you another reminder that pint is gone and unit is in. And nobody knows. Maybe after 5, 10, 15 years, the unit will be gone and something else will come in. This is how the life goes. So what are the shelf life of blood product? A surgeon or a physician or a doctor should remember all these figures. Red cells can be stored for up to 21 days in Pakistan. It can be frozen for 10 years or more, but you need a special type of freezer to keep them frozen for 10 years, which are not available in Pakistan. White cell and platelets are not viable after 24 hours. Coagulation factors are not viable after 8 hours of collection. Fresh frozen plasma, the shelf life is 1 year. Platelets are stored at room temperature in agitators for up to 5 days. So 21 days for RBC, 24 hours for WBC and platelets, 1 year for frozen plasma, and 5 days for platelet. So you must remember these figures. What are approximate critical levels of blood constituents? When your hemoglobin goes below 50%, it means that it has gone below critical level. Something needs to be done. Platelet counts below 10% are critical, and coagulation factors below 10% of the total are at a very critical level. So this is basically an arbitrary factor when you are dealing with a patient with a multiple trauma or a patient who is bleeding continuously, but according to one book, these are the critical levels. You have to keep it in mind and you have to do something for these blood constituents. A very interesting thing to know is that what are normal hemoglobin levels in Pakistan? Uh, the books we are reading for our normal curriculum in Pakistan are basically written by different authors abroad, and they have done studies on their own communities and on their own race. And unfortunately, they are not actually applicable 100% in Pakistan. So, in the last 8 to 10 years, there are some research papers published in Pakistan about the normal hemoglobin levels in Pakistan. So I have actually seen few of those papers and extracted these values. So approximate value of hemoglobin in female is 11.6 and approximate value for male is 13.04 gram per deciliter. So these are the approximate normal hemoglobin levels in Pakistan. Considering this thing in mind, you have to prepare your patient for surgery or during surgery or after surgery. You must keep these things in mind. A 42 years old female comes to OPD with moderate lumbar disc prolapse. You schedule her for microdiscectomy surgery, but blood CBC shows hemoglobin 7.8 gram per deciliter. You take a history, you do physical examination, you try to investigate anemia, and then you realize that this patient has got microcytic hypochromic anemia